Well, first, thank you, Mary Ann. Thank you for the opportunity to be here, and thank all of you. I also want to deeply appreciate the President's decisive leadership and support of the men and women of the CDC and our nation's public health professionals in your counties and states and around our nation, who really are working around the clock on the front lines to confront this outbreak. CDC is the premier public health agency in the world. We are the backbone of this nation's public health infrastructure. But a major and critical part of our work is our partnership with your county health professionals and to support your states and local, tribal, territory public health departments as we're currently doing in this coronavirus disease response. This outbreak began in December, and over the past 2 months, federal, state, and local governments have been mobilizing together to protect the American people. At a federal level, the U.S. government has launched an aggressive, multi-layered, public health-driven containment strategy to slow the introduction of this virus into the United States. Slowing the emergence of this disease has allowed our scientists, our public health officials, our medical communities to get time to learn about this unknown virus and unknown disease. Based on the best science available to date, we deployed an effective public health interventions to ensure early case identification, isolation of confirmed cases, contact tracing of those cases. This is a critical public health strategy to slow the progression of the spread of this virus. Slowing the spread of the coronavirus disease in our country also extended to our ports of entry, and it required an intricate partnership between multiple federal agencies in cooperation with state, local elected public officials, and your public health leadership. Under the leadership of the President, the United States took unprecedented action to include targeted travel restrictions, use of group quarantine for Americans that were returning from hotspots such as China and Japan, and directing flights to be funneled from mainland China into 11 airports to optimize screening and early case identification. CDC and the U.S. Customs and Border Patrol, and again, our state and local partners have been working together tirelessly and seamlessly to screen passengers, to identify ill travelers, to educate the well travelers, and to share our data to ensure that there's appropriate public health follow-up. We know that when we're confronting outbreaks like this, time matters. In December, China had fewer than 30 cases of pneumonia that were thought to be linked to a seafood market. Today, the world has more than 80,000 coronavirus disease cases and over 2,900 deaths. CDC and our local public health officials have a long-standing partnership in preparedness and response planning in the United States, and those plans are now being implemented by the White House task force under the leadership of Vice President Pence. We've asked the American people to prepare for new cases in their community, but to continue with their daily lives and be mindful that we are going to see more cases in this country of this virus. I'd ask you all as leaders to please recognize when there is detection of new cases in your community, that's a validation that your public health leaders are doing good work and are doing their job. We recognize that confronting this outbreak is going to require more staff, more supplies, and more capacity overall, and we are working to secure additional response resources that will be needed, particularly at the level of the local and state, territorial, and tribal health departments of this nation. To date, CDC has more than 1,500 staff working on the response. Hundreds have been deployed to the federal quarantine station centers from individuals returning from Japan and China. Many more have been deployed to state and local health departments to assist with investigations when new cases are identified, to conduct the contact tracing, to try to identify even further cases and stop the spread of this virus in our nation. And also additional personnel at the airports to facilitate airport screening. Finally, as we confront the challenges presented by this virus, I want to just emphasize that we're all in this together. We need your leadership to continue. It's going to be critical that together with public and private sectors, federal and local governments, communities and families across this great nation is fundamental to our overall response to this outbreak. On behalf of the dedicated men and women at CDC that I have the current privilege to lead, and working with you together to mitigate the impact of this outbreak on your families, your constituents, your neighbors, your communities, I'm confident that we're going to grow even stronger as a nation. I want to thank you, and God bless.